Welcome back, Careblazer. Thank you for being here. Today, I want to answer your questions. So I receive a lot of questions, and unfortunately, I can't answer them all in email. And quite frankly, I think most of your questions deserve more than just an emailed response. So I decided to put this video together to answer some of the questions I've been receiving from you. So this is Careblazer Q and A. If you have any questions for me that you'd like to see me answer in a future video, all you have to do is leave them below in any of my videos. Just leave your question in the comments below any of my videos. I read them all and I will consider them for a future video. This video is sponsored by my Care Club. It's a care course that I have that I offer only several times a year, and I believe strongly that it is possible to provide good care to your loved one with dementia and to also give yourself good care. And that's the whole point of my course. You get access to me with live Q&As, and you also get access to videos that no one else has access to. If you're interested in being alerted for the next time that course is offered, there's a link below this video. You can check it out and sign up just to get that alert. All right, now let's get started and answer some of your questions. So the first question is, where do you go to get neuropsych testing completed so we know what stage or what type of dementia my mom has at the current time? If you're interested in getting your loved one tested for dementia, the best bet is to talk to your loved one's primary care doctor. Let them know you're interested in getting formal testing, and that primary care doctor should be able to make the appropriate referral, usually to a neuropsychologist. You can also do a Google search for neuropsychologists or geropsychologists in the area, and you just want to be careful that your insurance covers that because testing can be quite expensive. I am a fan of making sure that the family talks to the primary care provider, because sometimes if the dementia has progressed so far, sometimes there's no real value in the testing. It's always better when you kind of catch it earlier. So it's good to kind of talk about, well, what are your hopes from testing? What do you hope to get out of it? To make sure that the primary care provider refers you to the right person and that you're doing something that will be worthwhile. In case you missed my video, I did a video a while back on how dementia is diagnosed. I'm going to link to it below this video so you can go back and watch it. Also, in terms of your questions about staging, you want to find out what stage your loved one is in, you don't necessarily need any type of testing to discover that. There are tools designed to determine what stage your loved one's in based on their current functional ability. So looking at different things like, are they able to dress, how many words they can say, what they're able to understand, their behaviors. You could do a quick Google search. It's something called the FAST tool, F-A-S-T, FAST tool for dementia, functional assessment and staging tool for dementia. And you can look that up online, and you might even be able to determine what stage your loved one is in right now. I also have a video on stages of dementia where you might be able to determine it yourself. I'll link to that below this video as well. So I hope that is helpful to you. Next question is, can you tell me how we can keep my dad from wanting to do his finances regarding his checkbook? He makes a lot of mistakes, and that is his last piece of independence. I love this question. It captures so many common struggles for Careblazers. It captures the struggle that you Careblazers face. It also captures the struggles of your loved ones with dementia who are trying to hang on to everything they can hang on to, but are finding that things are kind of slipping away. This question to me speaks volumes in terms of how much this Careblazer wants to do the right thing, but also wants to keep her loved one in as much control as possible. As you know from watching my other videos, it's very important for people with dementia to still feel like they have control in their life, that they are still able to do things. So when you do have to step in and help, you don't really want to highlight the fact that you're having to step in and completely take over. Now that's obviously easier said than done, but I want to encourage you to get creative and think about how you can provide the necessary supervision or the necessary help without necessarily calling attention to the fact that you're doing it because they're making mistakes. It's worth the extra time to brainstorm some creative ideas, because what a lot of Careblazers find is that when they step in and say that they are going to provide the help or that they need to do this now, they end up getting in a battle with their loved one because their loved one still thinks that they can do it, or their loved one still really wants to do it, and it ends up getting into this awful situation that makes life difficult more difficult for the both of you. As with most things in dementia, there is no one right way to handle this situation. However, I want to share with you a couple of options that have been helpful for other Careblazers in this situation in hopes that it gets your creative juices flowing. You could consider doing the finances together as a task that you guys do together. That way you can kind of oversee and kind of see where he's making mistakes and take note of them. So maybe you can come in behind him when it's not so obvious and kind of fix some of those mistakes. But instead of you just kind of swooping in and taking over completely, it's a task that you guys are doing together. You can also try setting up the finances through an auto debit program where all the bills are pretty much paid automatically online or automatically through a debit program. And you can kind of take this out of your court and say companies have been moving to the auto debit program, or companies are moving everything online, so everything's been transferred online now. Kind of saying it's just something that companies want to do. So if that's agreeable to you and that seems easy to you, you can just kind of put this one on the companies and say everything's online now, Dad. And then you want to come up with some sort of other activity or chore that he can do where he still feels like he's contributing and that he has something to offer. We don't just want to take everything away. So when we do take something away, try to see what you can come up with for an activity or something he can do at home. So maybe you can say, everything's been moved online now, Dad, but I could really use your help with blank. Right? I could really use your help with sorting the mail and giving him the junk mail to sort through. Or I could really use your help with going through the toolbox and having him sort the nuts and bolts, or whatever it may be. Whatever you think your dad would buy into and that he would enjoy, you can kind of ask for his help in those areas. That will make him feel better. That's another thing I want all of you Careblazers to keep in mind, is that asking your loved one for their help can be a wonderful tool to help them feel needed, to help them feel like they have something to contribute. A lot of times, as caregivers, you do have to step in and take some things away, but I want you to get creative in asking for their help. And it doesn't necessarily need to be anything that you actually need their help with, but you just put it in that way because it makes them feel really good. So you could say, hey Mom, you make the best lasagna. Can you help me try to make some lasagna as good as you? And then go on into the kitchen and try to go through that, right? Whatever it is, whatever you want to make up, but asking for their help is a valuable tool. Also, I just want to say, when it comes to finances, I have seen some horror stories of people losing their entire life savings. Unfortunately, there are people out there who prey on older, vulnerable adults, especially those with dementia. And I've worked with families who have lost life savings. So I think it's great that you're monitoring finances, or you're trying to find a way to monitor finances. If there is something where you do want to step in and provide supervision, I think this is a great place to do it. And also, sometimes people who are struggling with finances, or people with dementia who are still managing finances, they don't necessarily want to come out and say, I don't want to do this anymore, or I'm struggling with this. But sometimes you could just simply come in and say, and offer them help, or say, here, let me take that off your plate, or just transfer everything on the debit program or auto debit program. And they might not be that upset because it's kind of a relief and you were able to take that off their plate without them having to admit that they didn't want to do it anymore. So don't automatically assume that with everything that you're going to help with, that they don't necessarily want it. So keep that in mind too. All right, next question. I have my own anxiety and panic to deal with. How can I stay calm when my own anxiety gets provoked by her agitation? Being a Careblazer comes with a lot of stress. It comes with a lot of challenges, and it's completely normal to feel frustrated and aggravated a lot of the time. In my care course that I offer, I talk a lot about the role of our thoughts and how your thoughts are creating your feelings. So a lot of times caregivers think that my loved one did something, now I'm angry. But what I talk about in depth in the course is it's actually your thoughts about the situation. So my recommendation for you would be to really start to pay attention to the thoughts that are leading to your anxiety. Pay attention to the thoughts that are leading to your frustration. So whenever something happens and you all of a sudden notice a big shift in your mood, that you're really frustrated, angry, upset, anxious, whatever it is, I want you to stop and ask yourself, what is going through my mind right now? We don't often pay attention to that quick thought that goes through our mind. All we pay attention to is the situation, the feeling, and we link the two together as if it caused the feeling, when really there is a thought that is happening. It takes some practice. It's a simple concept that takes some practice. It might feel weird in the beginning, but I promise it can be helpful. Stop and pause and think, what just went through my mind? Multiple people can be in the same exact caregiving situation, but they don't all feel the same way. The reason is the thought about the situation. So my very first recommendation for you is to observe your thoughts. Try to identify your thoughts. I did a whole video on this. I'll link to it below, so you can go back and watch it and kind of get up to speed onto what I'm talking about here. Also, I cannot emphasize this enough. I want you to be doing things for you that help you. I want you to make sure you're prioritizing your own self-care. If you put yourself on the back burner and you constantly provide care for your loved one and you don't pay attention to yourself, that is a recipe for burnout, for frustration, for resentment, for anger, for all kinds of things that don't feel very good. So connecting with other Careblazers, exercise, eating healthy, taking advantage of the mini moments. In my course, I talk a lot about the thought blocks getting in the way. Self-care is not really needed. It won't do anything. What are others going to think of me? This is selfish. I feel guilty. I kind of get into the nitty-gritty in terms of those things stopping you from self-care, but you cannot get through this careblazing journey and still be in a good place without prioritizing your self-care. So I'd also recommend you start making sure you're not neglecting yourself. The next question I have is, my mom is 91 and is terrified of going to the doctor. At this age, is it really necessary to make them do this kind of testing? One way to think about any sort of medical procedure or test that you're thinking about putting your loved one through is to ask yourself the question that, would you change anything about the care or treatment you're giving your loved one based on the results, right? So if your loved one was offered a scan of their body for some reason, maybe they're having stomach pain and they were offered a scan of their body, would you change anything based on the results? If the results showed that your loved one had cancer, would you put them through treatments, right? So a lot of times we get into an automatic mode where something's recommended and we do it. Something's recommended and we do it. Something's offered, so we do it. We don't really think about, like, what's the reason we're doing it? Would we change anything based on the results? So if your loved one is 91 years old, they have dementia, quality of life is something that's very important for you and your loved one with dementia, and you wouldn't change anything about your situation or her situation, your loved one's situation, based on the results of that testing, then you might want to second guess whether or not you want to get the testing. I did a whole video on this in terms of should you go through with certain medical appointments. I'll link to that below this video as well. But basically, you just want to ask yourself, would you do anything with the results? Would you change anything with the results? If the answer is no, a lot of times people just opt not to go through with it. And I do think that there is a point in everybody's life when quality of life is something at the top of the list versus spending the last years of the life in and out of the hospital. That's a personal choice, and I can't make that choice for you, but I hope maybe this kind of line of questioning helps you determine the answer to that question. All right, last question. Hello, Natali. Beautiful work you do helping people. Would you please do me a favor? Tell me if you know the meaning in Spanish for your term Careblazers. I don't find it in dictionaries. Okay, I have a lot of people who follow me and write to me in English as their second language, and I love this question. So for those of you who do not know, Careblazers is a word I totally made up. It does not exist in any dictionary yet. Maybe that will change in the future. I made up the word one day while I was hiking on a trail with my husband in Arizona, and I passed a sign that said no trailblazing, meaning no creating a new path. And at that time, I'd been thinking a while about doing something to reach more caregivers. And I didn't really like the term caregiving. It felt like everything, all the attention was on the person who needed the caregiving. The caregiver felt neglected, and it kind of felt like if you were a caregiver, you couldn't have a good quality of life. And I firmly believe that it is possible to live a good life while caring for somebody with dementia. There's going to be hard times, there's going to be ups and downs, absolutely, but I don't believe you have to neglect and sacrifice everything. I think you can still live a life you feel pretty good about. I also feel like I didn't like how just caregiving just seemed to have a negative connotation altogether. So I made up the word Careblazer, and the definition is a dementia care hero. You. So all of you guys are Careblazers. All of you guys are heroes in my book. I think what you do is amazing. And so that's the answer to that question. All right, Careblazer, I'm going to be back next week. Again, if you want me to answer your question, make sure you leave it in a comment below. I will talk to you all later. Bye. Have a conversation. It's very important to have a conversation. You guys just sit down and to make the best, you make the best.